President Trump wants to increase Social Security benefits this year. How much could your benefits increase and when? Well, there are 7 proposals in front of the president to increase Social Security benefits. I am going to walk you through that. And there is breaking news out of Washington. There's the long awaited executive action that the president promised while he was campaigning to fix Social Security and remove certain illegal recipients from the Social Security rolls and thereby increase the amount of money that seniors are going to receive in Social Security benefits. So we are going to look at the latest executive order that was signed a few days ago and what that means for your benefits. And then watch till the end of this video because I have great news about Medicare. You can save $1,100 a year on Medicare. I am going to show you how. Let's begin. My name is Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years, we've been creating content to help seniors get the retirement benefits they deserve. We started with websites on Social Security, Medicare, Medicaid, food stamps, and now we are adding video content. I am also an adjunct professor. I teach finance at one of the most prestigious universities in the United States. If you're new here, please hit the like button, hit the subscribe button. We really appreciate your support. And as always, I want to know, where are you watching this broadcast from? Go in the comment section and let me know your city and your state. So let's get started. What is going on with President Trump and his plan to increase Social Security benefits? There are 7 proposals that Republicans are putting in front of the president to consider in not only increasing your benefits, but fixing Social Security for the future. I'm going to walk you through all 7 proposals, and you get to decide which one you think the president should focus his attention on and focus the attention of Congress in passing this year. So the first proposal is the Social Security Expansion Act. This has been around for a little bit, but never gained traction in Congress, and now it is being put back on the table. The Social Security Expansion Act, introduced by Bernie Sanders, Senator Warren, and others, would boost Social Security benefits by $2,400 per year. That means that you're going to get an extra $200 a month for every Social Security beneficiaries, including disability beneficiaries. Every time there's a Social Security increase, disability beneficiaries are wondering if they are included. Yes, you will be included in this. This would provide immediate and significant relief to seniors struggling with rising costs. The proposal is projected to lift millions of seniors out of poverty, addressing the fact that 26% of seniors currently survive on less than $17,500 a year. The plan would boost benefits by applying Social Security payroll taxes to all income above $250,000. So this is not going to take money, it's going to even add more money to the Social Security pot, ensuring that the wealthiest Americans contribute their fair share without raising taxes on 91% of households. According to the Social Security Administration's own estimates, this proposal will keep the program fully funded for at least 75 years while delivering larger monthly checks to seniors. It will keep the program fully funded. If they just did this by raising taxes on people making more than $250,000 and increasing Social Security by $200 a month, it will increase the Social Security solvency by 75 years. Let me know what you think about proposal number 1. Proposal number 2 is a new minimum benefit for low-income earners. This solves a critical problem because a lot of seniors are earning below the poverty level. Pending legislation in Congress will set a new minimum Social Security benefit for low-income workers, ensuring no senior who fully worked a full career received less than 125% of the federal poverty level. That will be about $1,518 per month minimum. For the lowest earners, this could increase, or it could mean an increase of $500 per month or $6,000 compared to current benefits. This change could directly benefit seniors who spend their lives in low-wage jobs, reducing senior poverty and providing a secure retirement. The proposal is also supported by advocates for seniors and is designed to ensure that no one who paid into Social Security retires into poverty, strengthening the program's role as a safety net. Proposal number 3, which could be controversial, is raising the retirement age. Why would they do that? because more people are living longer and claiming Social Security benefits longer. Current Republican proposals suggest raising the full retirement age from 67 to 69, similar to Reagan's previous increase from 65 to 67. This change will address 20 to 30% of the projected shortfall, making it a significant potential solution. You may already know this, but the Social Security Trust Fund is scheduled to run out of money in 2033 if nothing is done at all. And this proposal aims to fix that problem by covering about 20 to 30% of the projected shortfall. Critics point out that many people in physical labor jobs cannot work into their late 60s, making this change particularly burdensome for certain workers. This proposal will disproportionately affect low-income workers who often have shorter life expectancies and more physically demanding jobs. Let me know what you think about proposal number 3. Do you think the Social Security retirement age, the full retirement age, should be increased? You can still start claiming benefits at 62, but your full retirement age is when you get all the benefits you have worked and are entitled to. So the proposal is to increase that age at which you can get all the benefits you're entitled to from 67 starting next year to 69. Let me know what you think about that. The proposal number 4 is to adjust COLA, basically reducing the amount of cost of living increase you are going to get on an annual basis. Reducing cost of living by 0.5% will impact both current and future beneficiaries, making it an immediately effective but potentially controversial solution. This change will address approximately 29% of the long-term funding shortfall. Why does this make sense? Well, Social Security cost of living every year comes from the Social Security pot. So by slowing down how much increases retirees are getting each year, you slow down how much money you're taking from the Social Security Trust Fund, thereby extending the lifespan of the Social Security Trust Fund. And this will solve about 30% of the program's shortage. And so it is a significant solution, but a controversial one. Unlike other proposals, this would affect all beneficiaries, making it a more equitable but potentially unpopular solution. The impact of reduced COLA compounds over time, potentially significantly reducing the purchasing power for long-term beneficiaries. So this is a problem. It's going to reduce how much Social Security increase you're going to get and reduce your purchasing power. A lot of seniors complain that the little Social Security increase you get every year is then consumed by the Medicare Part B premium that is taken out of your Social Security check. So reducing your COLA even further then makes that situation even worse. So let me know what you think about proposal number 4. Proposal number 5, which could be popular, is to increase the payroll tax system. The existing system that Social Security is funded from is a 12.4% total tax on income. 6.2% is paid by employees, 6.2% is paid by employers, with self-employed individuals paying the entire 12.4%. So the proposal will gradually increase the 6.2% to 6.5% over 6 years, minimizing its effect on workers. It has broad bipartisan support. 85% of Republicans support it, 88% of Democrats, making it actually politically viable in the current environment in Congress. This change would affect all wage earners, spreading the burden across the entire workforce rather than targeting specific groups. Proposal number 6, the income gap removal. Now, this one actually makes a lot of sense. As of 2025, Social Security only taxes people who make up to $176,100. So if you make $500,000, you will still only pay Social Security taxes on $176,100. If you make $1 million, you will still pay Social Security taxes on $176,100 of your earnings. If you make $1 billion, it is still the same. $176,100 of your income will be taxed for Social Security purposes. The new legislation is supposed to increase this limit higher. There's a proposal for $250,000. Some are even proposing $400,000 as the limit. This would effectively affect 4% of the population and extend the Social Security Trust Fund, as I said before, by 75 years. If all they did to save Social Security was remove the income gap, it would save Social Security for 75 years. And they're trying to close all the loopholes so that people would not play different games to avoid paying Social Security taxes. This will apply to even investment income to make sure that regardless of how you get your income, you are going to pay Social Security taxes. And here's a good example. Somebody making $50,000 now will pay $3,100 in taxes. Somebody making $500,000 a year in the current environment as of last year would have paid $10,453. If the new cap, let's say it was moved to 400,000 and that everything above 400,000 is also taxed, there'll be a two-tax system. Everything up until 176,000 will be taxed, and then everything above 400,000 will also be taxed. If that system is implemented, this person making $500,000 would have paid $31,000 in total taxes towards Social Security instead of the current $10,453 they would have paid last year. So it makes a lot of sense. That's why this is very popular. Let me know what you think about proposal number 6. And then proposal number 7 is means testing. Means testing would evaluate income levels to determine how much benefit you get. So if you're currently wealthy, you get less Social Security benefit regardless of how much you've paid into the system. This approach will reduce the program shortfall by 11%, providing a significant but not complete solution. Polling shows high approval from both Republicans and Democrats, with Republicans supporting it by 90% and Democrats by 94%. Due to its targeted nature, it will affect 20% of income earners, preserving full Social Security benefits for majority of recipients. So these are the 7 proposals that are being pushed in front of the president to increase your Social Security benefits. The first 2 that I covered are about increasing your benefits. The last 5 are about saving the Social Security program and extending its solvency. Let me know which proposals you think the president should support. Let me know in the comments. Now let's move to this breaking news that just happened a few days ago. President Trump signed a long-awaited executive order to support the longevity of Social Security. This is a promise that he made during the campaign, preventing illegal aliens from obtaining Social Security benefits. On April 15, President Trump signed an executive order to prevent illegal aliens and other ineligible individuals from accessing benefits under the Social Security Act. The action applies to Social Security Act programs, including retirement, disability, and supplemental security income, which supports over 70 million Americans and distributes over $1.5 trillion annually. The order responds to reports of ineligible recipients, including individuals over 100 years old with mismatched records and those using fraudulent Social Security numbers. The primary aim is to ensure that U.S. citizens and lawful residents receive benefits, thereby protecting Social Security benefits for current recipients. Federal agencies must take all responsible measures to verify eligibility and stop payments to deceased or otherwise ineligible payees, including illegal aliens. The Social Security Administration, in addition, their fraud prosecutor program, it's suggested that it should be expanded into at least 50 U.S. attorney offices, prioritizing areas with large undocumented populations. So you should see U.S. attorney offices pushing to investigate Social Security fraud in cities and states where there are large undocumented population. States and localities that fail to enforce eligibility verification may face civil or administrative enforcement actions. In addition, the SSA Inspector General is directed to investigate suspicious earnings reports, especially for individuals aged 100 or older, to combat identity theft and fraudulent claims. Now, how does this affect you? What is the immediate impact of this on your benefits? Well, over 6,300 illegal immigrants have already been stripped of Social Security benefits and other federal programs. The aim is that by eliminating fraud, abuse, and waste, more money will be available that can then be used to increase Social Security benefits for current recipients. The SSA has removed Social Security numbers of flagged individuals to an ineligible master file, ensuring they cannot access federal benefits again. Then there's advanced technology now to detect anomalies in telephone claims and bank changes requiring in-person proof for suspicious activity. And then here's another one. With 40% of direct deposit fraud linked to phone-based bank changes, these new measures aim to reduce the estimated 33.5 million in misdirected benefits from 2013 to 2018. And then there's sanctions. It's going to cost you money if you abuse the system, commit fraud, or waste. The Social Security Administration is considering reinforcing civil penalties for individuals found guilty of Social Security fraud. These penalties can be up to $5,000 for false statement or up to $25,000 for each act of fraud or concealment. In addition, a new program will establish fraud prosecution for Medicare and Medicaid in at least 15 U.S. attorney offices, targeting identity theft and beneficiary side fraud. And then prosecutors will be assigned to the 10 regions with the highest population of illegal aliens, maximizing the order's impact. This is all coming from the White House. The Social Security Administration has publicly committed to implementing these measures to ensure benefits are paid only to those who are truly eligible. And then there's a protective order going on. By eliminating fraud and illegible payments, more funds remain available for current and future legitimate beneficiaries, strengthening the program. So that's the whole point, is that by cutting fraud and waste and abuse, more money will be available to be given to current beneficiaries. I think Congress will have to get involved in approving these additional increases. But the point is, if you reduce fraud and waste, more money becomes available that can be given in raises and increases to current beneficiaries. The order ensures that taxpayer-funded benefits only go to eligible individuals, reducing waste and abuse. With over 59 million seniors receiving retirement and survival benefits, the order prioritizes the security needs of American retirees. And then finally, the order also follows the February 2025 executive order ending taxpayer subsidization of open borders. According to the White House, more than 1,000 immigrants with criminal records or terrorist ties have been prevented from receiving benefits, that is Social Security benefits. So let's look at, this is from the White House. I went to the White House website, look at the fact sheet from this executive order. There are a few things I want to highlight to you. First of all, this is what the president is saying. He's expanding this enforcement to 50 U.S. attorney offices to make sure that Medicaid and Medicare are also investigated. And it also directs the SSA to consider to reinstate monetary fines. That is why this is happening now. And it is going to go beyond just Social Security. They're going to scrutinize disability benefits, Medicare, Medicaid, TANF, which is welfare, and other government programs to ensure that waste and fraud are being eliminated. And then the Congressional Budget Office estimate that there's $16.2 billion in cost to Medicaid for people who are not eligible, who may have been receiving benefits. And there is a cost to states and local government by subsidizing the benefits of people who are not eligible in the first place. And then lastly, the administration has stopped more than 1,000 immigrants with criminal records from receiving Social Security benefits. So that's more money that is coming into the system. This is all coming from the White House website. So let me know what you think. What do you think about the president's executive order? Do you think it strengthens Social Security? Do you think it goes far enough? What would you add? What would you change? What would you even do in addition to what has already been done? Let me know in the comment section below. And finally, let's talk about Medicaid before we wrap up. If you are 65 years old, you know you have to sign up for Medicaid 3 months before your birthday and 3 months after. You have a 7-month window to do that. And if you're currently on Medicaid, and you are not happy with your plan, or you're wondering if there is a better plan for you, there actually is. There's so much changes that are happening with Medicaid that it's important to know what plans are in your state, in your local area, that fits the doctor network you need, the drugs that you need, and fits your budget. And with all the changes that are happening in the news about Medicaid, in some states plans are being dropped, in some states hospitals plans are dropping, specific plans, and seniors have to face a difficult choice between sticking with their doctors or sticking with the health plan. You don't want to be in that situation. But the whole confusion around this is because there's so many plans out there, 24,000 Medicare plans nationwide. That's why 90% of all seniors are in the wrong Medicare plan, because trying to find the right plan for you, your budget, the coverage you need, making sure that you pay attention to the many options, restrictions, and costs can be a daunting challenge, and it does not have to be this way. So we have partnered with an amazing company called Chapter Medicare. Their goal is to make Medicare simple for you to understand, to choose the better plan, and to be able to use your Medicare benefits. Not only are they helping you understand and choose a plan, but they want to also help you maximize your benefit. And this came out of a personal experience. One of the co-founders of Chapter has watched his parents struggle to navigate the process of choosing a Medicare plan and wound up paying premiums that were hundreds of dollars a month more than they ought to have been. He realized what a terrible experience the whole process was and decided to do something about it. And another co-founder, who is an expert on Medicare, actually wrote one of the leading books on it. And as an attorney, said this, which is one of the things that made me pay attention to this group. When I first started my job as a Medicare advisor, I discovered that many Americans are getting misled into buying the wrong plans, and simply because no one took the time to sit them down and explain what's going on. That is what they want to do for you. So why are we partnered with Chapter? It's been 15 years. We have not partnered with a Medicare advisory company. This is the first one. Here's why. 3 reasons. One is because they are the only free and unbiased advisor that has access to all the 24,000 Medicare plans. You heard that right. They see everything, including plans that are in your local area, and can recommend the best plans for you that fits your needs, your preferences, and your budget. Number 2, they do not incentivize their agents, their licensed agents, to push a particular plan. Their licensed advisors will advocate for you, not the insurance company. That is a very refreshing thing to read. They work one-on-one with you to align plans with both health needs and budget constraints. And then number 3, they can save you up to $1,100 a year on average. But you have to call Chapter today, 539-205-2147, and they can help you get you into the best Medicare plan. Or you can go to the website askchapter.org/insider, and there's a form you can fill out and they'll reach out to you. But you have to act soon, because there may be a very small window for you to be able to get into a better plan, especially if you're turning 65 and need to get on a plan. There is a 7-month window to do that. Otherwise, you can incur some penalties. And if you're currently on a plan and are wondering, can I get on a better plan? Well, you don't want to be part of the 90% of seniors in the wrong plan. So call Chapter 539-205-2147 and see how they can help you get into a better plan. When you call them, you're speaking to real agents. I went to their website. These are their Medicare advisory team. These are real people, and the list goes on and on and on. They are there to help you. And here's the kicker. Chapter will show you every Medicare option, including detailed information about doctors, specialists, prescription drugs, and hospitals that are covered, what the copays cost, and how the plan they're sharing with you compares to traditional Medicare. These guys want to show you everything and help you choose the best plan. So call the number on the screen or go to the description in this video, and there will be a form there you can fill out, and they'll reach out to you. And did I mention they can save you $1,100 a year? So it's a no-brainer. They are highly rated, A+ with the Better Business Bureau, lots of 5-star reviews. These guys are the real deal. So call them today. And then finally, if you're overwhelmed by all the news that is coming out in and out of Congress about food stamps, Medicare, Medicaid, Social Security, personal finance issues that affect seniors. Well, we have a newsletter now that we can keep you updated on all these changes in real time. Go to our website, benefitsinsider.co/subscribe, or you can even go into our YouTube channel. At the top of the page on our YouTube channel, there's a link to our newsletter. Sign up today and be the first to know about changes that can affect your benefits, and we'll bring it to you in real time. So thank you for watching this video on this Easter Monday, and I look forward to seeing you tomorrow on the next video.